Going back to the politics of the situation, people might be cynical that this was called for in the run into elections, and maybe the general election might come and go before the review is delivered and actioned, if it's ever actioned. There's a lot of reviews in the Department of Health over the years, Minister. I'd say they probably wouldn't all fit in the building. There must be a very big vault. So when is this review, when are they going to report?
Thanks, Deputy. Well, we're going to finalise the terms of reference once we have the Frank.
Oh, they're not finalised yet, no?
We're going to finalise them once we have the Frank Clark report. That's due in the next few weeks. And Deputy, I'm sure you'll agree that in setting the terms of reference for what is a very important report, we should be cognizant of whatever comes out of the Frank Clark report.
Of course.
So we're going to set those terms, and then we'll talk to HIQA about timing. And can I just say on the political point, look, I understand why you would make the point. I might well make the point myself if I was sitting where you are. I can tell you clearly the reason that I have asked HIQA to do this, and it's what has happened in the hospital in the first 4 months of this year. So if we go back last year, when we looked at UHL, the waiting lists were falling rapidly and the number of patients on trolleys was falling. Now come to this year, and what we're seeing is a very significant reduction in patients on trolleys all over the country, and in total contrast, UHL completely on its own has had a 40% increase. And it's in response to this year's increase that I've asked HIQA to do this review.